Day 3 in London. Guys in St Thomas's Hospital doing a fabulous job. Great talking to me. I have spent some really lovely times talking to the different people, both involved with my case, but also people I've just met there. I've met other patients. I've met staff doing various different things. It's been a very pleasant experience. But this was a Wednesday, and it was a difficult day. This was a day where I was going to have an operation. It's called a laparoscopy, or whatever. Again, it's an investigation. It's with a camera, and basically what they're going to do is they're going to have a look and see. So I think, if I remember correctly, they were going to do down that way once, and then they've got put a couple of incisions down in my lower area, one through the belly button and one just to the side of it. I have no idea which ones would do which and so forth. I would imagine that one of them is to let the air out or something. I don't know. It didn't matter. All I knew was that they wanted to have a look-see. And, that was why I was there, effectively. They did, the ultrasound endoscopy was just another investigation. This is another one. A little bit more intrusive. And I'll tell you, it still is tender and painful. Not pain as such, but it's tender, which hurts. So the day didn't start with the laparoscopy. It started with basically another meeting, and this time I was meeting with the chief nurse who's in charge of my case up there in London, Liviana. Fantastic, very helpful person. And I saw her a bit later in the day as well. I also got to meet a doctor. I don't exactly know who it is. He may well have introduced himself, and I do apologise, doctor, if you're watching this, but as you can probably imagine, there was a lot of things in my head at that time. And he told me really something that, I'll be honest, I wished he hadn't. He told me a little bit about the operation that was to come. And Oliviana also had told me some about that. And basically that really put me in a high stress situation. So I'm not criticising, it's just I would have done it at a different timing if it was me. Because then I went into this laparoscopy with these visions in my head of what was going to happen. And I'm not going to tell you those now. I'll tell you those after we speak. I've spoken to the doctors with regard to my treatment plan, because they might not be applicable. We will see. So after these various meetings, tests and so forth, to be honest, it was a blur. I can't remember what even happened. But I then went up to the basically free surgery department, where I was answering the questions, all the same questions again. But I was also I meet one of the surgeons, who basically had a look at me, and because I had a umbilical hernia, I think it's called. Basically, my belly button was a little bit blown out, and he had a look at that, and he sort of said, "Oh well, we'll go do around here, we'll do this and so forth." And so I said, "Yeah, well, I'm going to be knocked out, so I don't really know what's going to happen. No, or be honest, I don't really care. Well, I do, but not in the sense of I want to know the details. No thanks." Just know what you're doing is going to be good for me. And then I got to meet this absolutely amazing woman. She's the anaesthetist, and she's obviously a senior anaesthetist. Sorry, my tongue doesn't always get around these words. And she was incredibly attentive to knowing about my situation. I had explained to her about what I thought had happened in the ultrasound, and she started asking me questions, and I was telling her all the situations, particularly about the claustrophobia, and also the sleep apnea, which I just basically said and almost dismiss it. But she sort of said, yes, well, I need to know about that sleep apnea. And she explained why. And I thought, wow, I didn't know that. And, bit by bit, I'm learning more about the treatment that's going to happen, the various operation that I'm going to do. And what she did was she put together a plan for my sedation whilst I was going to have this minor operation. The laparoscopy is just keyhole surgery, basically. To go in, have a look-see. I think they took some biopsies while they were there, by the way. And essentially, she planned out my anesthesia, or whatever it is. It sounds like one of those fairy tales, doesn't it, Alice? Princess? Yeah. Anyway, but I was so... I forgot all of the problems that the doctor told me about, not this surgery, but the next one, that are gone out of my head. It was incredible, because she said, look, what we'll do is I'll make certain it's on the system, so that if you have an anaesthetist who's not as experienced as me, she said, then they know how to deal with your case. And I thought, somebody using the technology as it should be used, putting in records, making certain people know how the patient needs to be treated. Exactly. Perfection. What I wanted to see. And we went through it. She sort of says, right, well, we would normally, you'd be just going under as we put in the air pipe and so forth. But with your claustrophobia, that would be done before. And when you wake up, we would be taking it out as you're waking up. And again, we'll do that before you wake up. So everything was being explained to me and planned to fit me, which was so incredibly reassuring. Then we went in. This was a lot later. I was on again. I seemed to be at the end of the surgery plan, and we went into. I suppose it was an ante-room. I don't know whether they took me into another room or not. The theatre. I think so. I think this was just the anaesthesia area leading into the main operating room. And I had, what was it? There was the anaesthetist and a couple of, I think they were nurses. I don't know exactly, but they were lovely people, all focused on making me relax. Perfection, girls. I loved it. Sorry, I use girls. I know. I'm sorry. I'm bad boy. Right. Thank you very much. You did an amazing job. You are professionals. I felt wonderful. I remember as you were feeding me the sedation, you kept me talking. I was totally aware of what you're doing, but I wasn't going to argue. I was going to keep talking with you until I went, gone. And it was magic. And then you woke me up. And that again, I had no idea where I was. It wasn't like the first time I'd ever been on a general, but it was. I woke up slowly, and I was a bit, groggy to begin with, and then coming round. But the nice thing was there was no fear, there was no problems. It was a calm environment, and I felt safe. If you're going in for that, for an operation, any form of operation, that's what you want to know. It's safe. These people, I didn't see the surgeons. I had no idea. I've no idea who did it. I know his name. I'm sorry, it's not Doctor, it's Mr., isn't it? Mr. Mark Winters, I believe it was. Oh gosh, I'm getting it wrong. Or is it Kelly? Kelly. Anyway, at the time I knew I'm sort of not. I forget things if I don't need to know them nowadays. I've always had a bad memory, but now I'm very selective as to what I remember. So anyway, I don't knowingly know the surgeon apart from the one that I spoke to in the preparation section. So it went well, but I don't even know how long I was under, but I think it was quite a while, because I seem to think that I lost about an hour and a half, maybe 2 hours. I don't know. There wasn't actually anyone that when I had any common sense that I could actually ask, which I would have liked to. So I must talk to somebody when I speak to them next, and just get to know why, how long I was out, because I know for the next operation, this is a major operation, and I've been told that I'll be out for 7 or 8 hours. And I've been told a lot more about that operation, which I'm not going to tell you now. I'll tell you after I've had my treatment consultation. That surgery does scare me. But this one, it's now quite painful, right? Because they've been moving around up and in there, sort of pushing this and going. And I'm looking. It's not surprising. It's painful. The wounds are fine. The wounds are really great, and I don't even have likely of scars because they've used super glue. I'm glued together so I don't fall apart. Absolutely wonderful. So this one's nice and smooth. My belly button it feels a lot rougher because it's not a smooth piece of skin, so it's not likely to be. So basically on that surgery, I was, that was fantastic, exceedingly excellent job. From that point onwards, maybe not quite so good. Hang on. Before first, let's talk about recovery. Recovery, brilliant, right? Looked after very, very well. To be honest, I have found all of the recoveries I've had to go after sedation exceedingly good. Whether it be down here in Ashford or whether it's been up in London, those staff are focused on you. So you're going to be looked after the event. They do a really, really good job. And they've given me information which has helped me understand what's actually happened. Now, I got moved then to a ward, so I was going on a long trip trying to find, and eventually I was up on the 8th floor, and in a ward, and where I could just basically relax. Now, bearing in mind that after recovery, I could have gone home. Okay. If somebody had come and picked me up, I can't drive home because I still had this sedation in my system. But this is why I was staying there, because basically it's unreasonable for me to expect anyone of the family to drive up on that Thursday to come and collect me. I wasn't going to do it because basically, like me, all of my brothers and sisters, we're all old, so I didn't want to just impose on them all that sort of long drive. So, and I was happy just to relax there and unwind and jump on the train the following morning. Okay, well, actually afternoon, although it turned out to be morning. I'll tell you that later. So we're in there, but I still had the cannula in. Oh, by the way, they got it in first time. That's the anaesthetist and team. Good job. No stabbing, but nobody took it out. Right? If I'd have been going home on that Wednesday, it would have been taken out, but nobody took it out. Now that doesn't sound like a major problem. I'm in a hospital, no problem. Well, it is, because what happened is that it was in until late morning on the Thursday, and it kept getting knocked and knocked and knocked, right? And I mean, I don't know whether you can see it, but you can see that there's now a bruise coming. There's where the incision was. But worse than that, basically, I think you can see there, this is inflamed, and I've had to get some antibiotics to fight off whatever the inflammation or infection, whatever it is, it's happening. And I think that's basically because when you knock the cannula, I mean, basically it's a tube which sticks on the outside with a needle that goes into your vein. And when it gets knocked, that needle's going like that. And so what's happening is it's puncturing probably outside of the blood vessel. And so this has gone bruised, and something is inflamed this all the way down here and up into here. And so I would say, because I know what the complication was, I do understand this, is basically I was an outpatient, okay? But they put me in overnight, temporarily, but I wasn't an inpatient. So all the procedures for inpatients didn't click in. So basically there was nobody there to take out this when I got there. Nobody took it out in the recovery because I was going to a ward, and when somebody goes to the ward, they're an inpatient, so they don't do it. Yeah, but I wasn't. I was an outpatient. Okay. So I've had to take, or am taking, antibiotics to fight this inflammation, and it gets a bit itchy and not so good. I was obviously a little bit concerned that it might get inflamed and maybe even infected and so on there. So that was a no-no, that was a negative. And also what was happening is, because I was an outpatient in there, that nobody came to discharge me. So I'm getting there and I'm thinking, I want to go home, I've got a train to catch, and I was getting upset that there was nobody coming to discharge me. I found out that all that the doctor needed to do, as I understand it, and I appreciate, got the full day's work on the Thursday. I was a Wednesday job, right? But nobody just wrote, he can go. Okay? Now, if there was anything more to it, I apologise. But in the end, I said, I'm going, right? And in the ward, there was somebody doing painkillers and taking out this and that, and they took the cannula out for me. Thank you very much. Lovely, the two of you, for helping me on that side of things. So, Thursday was not a good day. There wasn't systems in place to look after an outpatient in a ward. I'm sure there's not many people that fit that bill, but it's going to happen again and again. So I'd suggest that you have a look at those systems. That's as a suggestion, okay? As far as the operation is concerned, I am so happy with what you did. No problem at all. I would like to know, did you fix the hernia? Because it looks like you did, but I don't know. Until the swelling goes down, I won't know. But fantastic job on there. Lovely anaesthesia. I'm just, over the moon with London. I'm over the moon with Ashford team. It really has been exceedingly brilliant work. But now, I have a meeting, well, a phone call to on my thing, because my esophagus cancer is one of the rare ones. Now, I don't know why it's rare. That's one of the questions I'll be asking them. And it's going to require, potentially, a far more extreme set of surgery than I would be happy with. But let's put it this way: is all I'm here for is to make certain I beat cancer. That's it. I want to beat cancer. I ain't giving up on I'm going to beat that cancer. So the question arises is obviously, if that's what I've got to do, I've got to do it. There's no arguments on it, right? There may be, ooh, I'm scared, very scared. But I'll do it, right? If it's done quickly, no problem, right? If it's done after chemo, no problem. Whatever the doctors say is the right way to do it, within reason, I will follow their lead. That's what they're there for. They are the experts. I am not an expert on curing cancer. So that's their job. And this surgery, it's got to be really, really leading edge surgery, right? Because when I first looked it up, it wasn't on the NHS website. When I looked it up last week, it was on. And I thought, wow. So I'm going to be one of the few that have had this. Very few, probably. And I'll find out if there's... there's got to have been people who it's been tested on, right? Because it's in the website, it means it has already been tested. Because no one's talked to me about this being untested, system. So I'm quite happy to do it. Well, no, that's wrong. I'm not happy to do it. I will do it, but I'm not happy to do it because of what's actually involved. But what it will do is it's a 7-8 hour operation. That is major, right? And what they do is they're going to have to collapse one of my lungs to be able to do the surgery that needs to be done. So there is risk. In fact, there's higher risk than normal surgery because of that. So I've been told what I've got to do to change my lifestyle to make the success of this operation more, raise the percentage. Okay? And I'll do it. Right? And one of them is I'm a very, very bad boy. I vape. I used to smoke cigarettes, but I vape now. I was going to say goodbye. Right? So vaping has got to stop. I've got to lose weight, which I was doing anyway, right? But I've got to lose it quicker. And I've got to get back fit again. Because since COVID, I've allowed my routine of exercise to just, go to pot. That's my fault. That's nobody else's fault. Not even COVID's fault. I allowed it, right? I take responsibility for my decisions always. So where I am today is, I'm in a place of, I'm in sort of temporal situation hanging around, because until on Wednesday, the phone call that I'm going to have with the surgeons, with my oncology team. I don't know who exactly I'm going to talk to, but it's the London team, and they're going to explain to me about the treatment they're going to have, whether it's going to be chemotherapy, whether it's going to be chemotherapy with radiotherapy, whether it's chemotherapy followed by an operation, followed by more chemotherapy, or whether it is extreme, straight in to surgery immediately. And all of those things are dependent on what they've discovered over the last few weeks. So everything I've done to date culminates on Wednesday. and I will find out exactly what's going to be done. Now, if you think that's scary, trust me, it is. I'm not looking forward to that, but I am looking forward to it because I am going to beat